So this technique that we're going to talk about today is one that involves you with your patient, and if there's a partial involved with crown and bridge, so the patient has a partial existing and you want to take an impression for a crown. And instead of sending the partial to the lab, there is a technique that is available that I will share with you today. There are some different ways of doing it. There's taking a PVS impression with the partial in place, but then the patient has to go without the partial. Another way would be to send the patient with, or send the partial down to the lab once we pour the model up and we retrofit the partial to the model. It's not really an accurate way. I wouldn't recommend it, but sometimes it's inevitable that the patient doesn't want to go without the partial. So this will prevent you having to send the patient or the partial to the lab. So let's go through the process now. So we'll assume that you're chairside with the patient, you've done the preparation, and so now we're going to introduce the a bite registration material. The one that I have today is Occlufast, and it has a Sure hardness of 95. It's an extra hard and it's a fast set. It works quite well. There's a couple others available on the market. There's Blue Moose, and there's also Foot RD, which is a good one as well. So what you do is just bleed the system, of course, first, and then extrude a little bit onto the preparation site, and then put your partial in place. And if you feel you need a little bit more, then just extrude a little bit more into the site. This can all be cleaned up afterwards. You can actually at this point have the patient bite down onto this, and then it actually holds everything in place as well. Okay, so this is set up now, and I've cleaned it up a little bit with a sharp blade. Not necessary for you to do that. You can just actually send it to the lab as is. And then what we do once we have the impression, we'll pour it up, get our dies ready and so forth, get the case mounted, and then we'll take the piece that you fabricated chairside and we'll place it on the die. And then from there we'll use this. It's a GC pattern resin, but it's in gel. This particular product is from Primotech, and it's a light cure material. So we just extrude this into the site where the clasp and the reciprocal arm, as well as the rest, is. And then I'll extend it over to an area that I know will be able to get a good seating so that we know that it's not going to move. So in this one here we have a nice big molar there with a lot of occlusal morphology, and that'll be a nice place to rest this whole thing so that it's not going to move on us. And then we'll just hit it with some light cure. Usually I'll just zap this for a couple minutes and then maybe put it in the triad for another minute or so, and that's usually good enough. And there's our clasp and our rest. So the whole assembly is there, and it's going to rest on this molar here, which, as I said, has quite aggressive anatomy, so I know I'm going to get a good seat there. And then we just wax up around that. and we have an exact replica of the clasp.